without much ado, I will move on to address the issues that relate to the KEMSA reforms. And this is the address. Now, the board of the Kenya Medical Supplies Authority, which is KEMSA, confirms that the organizational reform efforts have been stepped up to position the authority as an effective player in the local healthcare system. As an institution, KEMSA is a strategic state corporation mandated to undertake roles and responsibilities to ensure supply chain excellence for health products and technologies, which we usually call HPTs. Currently, KEMSA serves over 8,000 health facilities from Embakasi National Supply Chain Center, complemented by an additional devolved network of 11 warehouses, 4 of which are in Nairobi, and 7 spread across the towns of Eldoret, Kakamega, Kisumu, Meru, Mombasa, Nakuru, and Nyeri. These facilities provide last-mile delivery services for our national medical supplies, serving communities as close as Mukuru kwa Njenga in Nairobi County, and as far as Manda Bay in Lamu County, or even Kibish in Turkana County. This board was appointed by the Gazette notice on April 28, 2021, and inaugurated early May 2021. Following the inauguration, the board immediately commenced on a process to institute an organizational rejuvenation strategy. The formulation of this strategy has been widely consultative, internally and externally. Indeed, the board is grateful for the support provided by the Public Service Commission, PSC, the State Corporations Advisory Committee, which is CAC, the Ministry of Health, which is our mother ministry, the Ministry of Public Service and Gender Affairs, KEMSA staff and management, among other stakeholders. In early July, a multi-agency task force was formed to provide independent operating recovery strategy for KEMSA to facilitate organizational effectiveness. The KEMSA Immediate Action Plan and Medium-Term Reforms Working Committee, which is KIA-PRWC, comprised a panel of local public service administration experts backed by international counterparts who were drawn from the World Bank and the African Resource Center. KIA-PRWC has been tasked to do, among other things, the following. 1, review the current organizational structure to determine its efficacy. Number 2, review the current staff establishment and the staffing norms in KEMSA. Number 3, to establish if the current career guidelines were responsive to the current client needs and the mandate of KEMSA. 4, determine whether the current HR policy and procedures were properly attuned to the Constitution, the country's labor laws, and other relevant legislations. Number 5, assess prospective modalities for the reorganization of KEMSA to meet its mandate, current challenges, and also demands of clients. Number 6, to review the KEMSA Reforms Implementation Committee, that is KRIC, reports, and take into account the immediate action report thereof. The committee has now completed its assignment and has provided a detailed report to the board. The report has revealed challenges in critical functions within the authorities that deserve to be expeditiously addressed. The challenges identified in the report confirm that KEMSA, as an authority, is currently grossly underperforming and largely unable to meet clients' urgent needs, particularly the delivery of essential medicines and products to the counties, referral hospitals, and to the programs. This has indeed endangered the lives of Kenyans and is gravely threatening the realization of universal health coverage, which is critically predicated on a successful and optimally operating KEMSA. The key challenges are divided into 4 buckets. 1, there's a financial crisis. This is manifest through lack of financial controls, with a debt crisis arising from structures that are not optimized to collect the debts. Then there's a supply chain crisis, that is the second challenge. This has led to low order fill rate in our warehouses and a very high turnaround time, or TAT. The third one is warehousing and distribution, where we have chaos, and this is manifest through dead stock, purchase of non-priority items, and poor optimization of distribution models. There is also number 4, where we have procurement chaos. Here we experience long lead times as a result of operating inefficiencies. After review of this report, the board then holds that these challenges will require further review of KEMSA around 3 key areas. The first one being the structure of KEMSA. In this, the organization structure establishes the degree to which it is constrained in achieving the strategic objectives. Then we have number 2 as governance, to determine the best fit approach to leadership and to oversight across the organization. Then we have the processes as number 3, to determine the gaps in the organization processes, procedures, and technologies. So, as the review gets underway and in compliance with the legal requirements governing labor management, the board has issued general notice letters to all staff working with KEMSA this morning. As per the general notice letters issued, all non-core staff members have been released to work from home as the necessary consultations progress. The core operating teams and our caretaker management team have been notified, appointed, and mobilized to ensure seamless operations in the intervening period. The board confirms that the necessary interventions have been put in place to avoid undue disruptions to service delivery and the day-to-day operations of KEMSA. The release of all staff to work from home is a procedural formality to facilitate the review of the organizational structure, and this will be undertaken expeditiously to ensure that the staff complement is fit for purpose and within the approved staff establishment levels. Attendance sensitivity and empathy will be maintained as the board is committed to ensuring a smooth review, and the following support measures have indeed been put in place. 1, continuous staff engagement and consultation within the next 30 days. This will ensure departmental and team engagements are undertaken, and will ensure communication of internal meeting schedules and communication with staff through official channels and through the relevant supervisors. Number 2, commitment to inclusivity. All staff will be engaged and appraised. They will all be engaged and appraised throughout the notice period. And then there's the issue of psychosocial support, which the board has taken into consideration, and the necessary counseling and psychological support will be availed to all staff with no exception. The board is committed to facilitating the necessary reforms to ensure that KEMSA challenges are sufficiently addressed. This commitment includes aligning the organizational structure to industry-accepted standards for a health, commodities, and technologies procurement organization. It also calls for the introduction of global best practices, which include acceptable span of control, transparent reporting relationships and command structures, compounding related functions for strengthened accountability, and finally, a redetermination of optimal staffing levels and norms. Ultimately, as the board chair, I am encouraged that the KEMSA staff, management, and other operating partners have expressed a commitment to supporting the envisaged reforms. These reforms will provide the foundation for achieving the Big Four health goals, including the realization of President Uhuru Kenyatta's much-cherished UHC program. The board commits to provide progressive updates on the reform milestones. And this is the end of our statement as a board.